Some health news for veterans. A better benefits plan is on the way. Channel 5's Angelo Vargas learns about the VA's new mission for better health care.
It's called the Mission Act. It was signed into law last year. VA officials say veterans will get faster care closer to home. We remember sacrifices made by those fighting for our freedom and those veterans who still serve.
I was a 68 kilo, a medical lab tech.
A combat medic. I went to Kuwait and Iraq.
Laura Vela and Rolando Garcia are from two different Valley cities. They joined the service with the same pride. They wanted to better their country in the United States Army. Vela is the first female in her family to join the military.
After 9/11, there was a motivation there that I needed to serve my country the best way that I could, and the Army was my choice.
Vela was working at a furniture store before she joined at 30 years old. She left her family for 4 years. In that time, she became a mother to her new military family.
You were like my second mom, and a great friend. Call me and keep in touch. Hey, Mom. Well, Mom says it all. You always helped all of us, and I'm glad I met you.
Vela came back with injuries she suffered during her trainings and service. It was difficult for her to get treatment with the VA at first.
Statistics tell you that our female veteran population is increasing here in the Rio Grande Valley. So they're coming back. Where are the services? There are no services. The VA is designed to cater to mainly male veterans.
She also knew more could be done to improve health care for all veterans. She was hired by the VA. Vela was a voice to get the Mission Act passed. She was there when President Donald Trump signed it into law. Before the act was a law, the veteran was referred to a provider who had to get treatment at a VA hospital. Now that has changed.
The veteran has a choice. Do I see the VA or do I want to see my outside provider?
Vela knows many veterans may not know about this benefit, like Garcia. He was also the first in his family to join the Army. He lives in Port Isabel and must travel almost an hour to get a treatment in Harlingen.
We have different health issues, and not everybody is the same.
The Mission Act means a halt to those long travel times.
For veterans, it's very important that they know that now health care or any care is available to them within their communities.
Vela says she's living proof this mission of having a choice will save her life and her military brothers like Garcia, as well as her fellow sister veterans. The Mission Act takes effect June 6th. Vela encourages anyone who has questions to reach out to their local VA clinic. In the Channel 5 News studio, Angelo Vargas, Channel 5 News at 6.
We wanted to know more about how the Mission Act will help veterans when they go for an urgent care visit. This is a Channel 5 News Extra. Health Administrative Service Chief Efren Cerda Cantu explains the Mission Act will provide veterans care where and when they need it.
And this urgent care will be available for veterans based on certain criteria that they could seek in the community without having pre-authorization.
Cerda Cantu explains the VA will hold a town hall meeting about the Mission Act on Tuesday, June 4th at 6 p.m. It'll be held at the Edinburgh Conference Center at Renaissance on 118 Paseo del Prado. For more information, call the VA call center at 855-864-0516.